Now, President Biden just announced that we are on track to have enough vaccine for every adult by the end of May. Now, that was previously set for July. So, to help us better understand the different vaccines and what's happening and how we can all become vaccinated, we're joined once again, very pleased to have Dr. Jeff Pothof from UW Health. And that is good news from President Biden today. Your reaction to that, Dr. Pothof?
Yeah, I think it's great news whenever we have increased supply, increased doses to get people in the United States vaccinated more quickly. That's just got to be great news.
Yes, a lot of people keep talking about the differences of the vaccines, and we know that Johnson and Johnson is coming to Wisconsin right now. What about people who are concerned about the differences of the vaccines and might be reluctant to get Johnson and Johnson because of that lower efficacy rate?
I think this is a great question because when you hear the publicly reported efficacies, you're hearing that Moderna and Pfizer are 90%, 95%, and that Pfizer's, in the 60%. And people will say, why would I want, or the Johnson and Johnson, the 60%, why would I want Johnson and Johnson? The important thing to look at is people who get severe disease defined by hospitalization or death. And people who get any of these three vaccines, they don't go to the hospital because of COVID and they don't die because of COVID. And that's really the metric we have to look at. So when a vaccine is available, go ahead and get it. Don't worry about who it came from.
Yeah, that's very important. And you really just ultimately want to save your life. And that's what these vaccines are doing. Dr. Potoff, for people who are, waiting and they're eligible, but they still haven't been called to get the vaccine, do you think this process now is going to speed up now that we have our third vaccine?
I think it certainly helps. The more doses we have available, the better we can work through these tiers so that people that are 65 and older, they can get their vaccines. That allows the next tier to happen with, teachers, educators. So the more vaccine doses we have, we know that the vaccinators are ready to give it. It speeds this whole process along tremendously.
Do you have anything to say to people who might be thinking, okay, the vaccines are here and now I'm going to go on vacation, hold a big party? Any message for anybody thinking about that at this point, Dr. Potoff?
I think the message right now is to be careful and look at what public health is recommending. This isn't a light switch where we can just go right back to normal, but as numbers improve, as vaccines get out there, it does become safer to do certain things. So don't just think things are back to normal. There's still restrictions, mitigation efforts that need to be in place, but it's good to see things lightening up a little bit.
Yeah, they are back to normal. How concerned should we be about these variants that are out there, and we still haven't had a total influx of those yet here in this country?
Right. The variant is something to be a little bit concerned about. With the variant, what we could see is another little rise in cases. And it's really a battle against time as to can we get vaccine out there to effectively make the variants not a player in this game? Or do the variants start to spread and we start to see additional peaks of cases, which may roll back some of the more recent kind of restrictions that were eased for folks?
Yeah, a lot of fear about another peak. We certainly don't need that. Dr. Jeff Potoff, UW Health, always good to have your expertise here. Thanks you once again for joining us this afternoon. We really appreciate it.